We now have 140 confirmed cases. Can you give us profiles po ng mga bago? Yesterday we had 29 new cases. Are they all from Metro Manila?
The 29 cases, we're still trying to verify some of the information coming from the 29 cases, Ruth.
Yes, ma'am. Can you tell us if like most of these are which age bracket or my travel history? Do you have already that kind of information?
The travel history, not yet, but most of them would be in the middle age groups, whereby there are more than 40 years old, and then we now have again more than 60 years old patients.
More than 60, ma'am?
50.
50.
60 years old also. Yes, yes.
Okay. Yesterday kasi ma'am, merong medyo 13, was that 13 years old or?
Yes, that was included in among the 29 new cases, a 13-year-old person where we are getting now the history of travel or exposure for this child.
So yan po yung pinakabata, Yusek?
Yes, this is the youngest among all of these 140 cases that we have right now.
Okay. Ma'am, are you seeing a pattern with the cases? We're now 140. Lahat po ba to linked? Or can you just give us an overall picture of the cases right now?
Well, according to our initial analysis, most of them have exposures. About a quarter of them would be coming from histories of travel. And some of them really do not have any exposure nor travel.
Okay. Ma'am, in terms of testing, kamusta po ang testing natin ngayon? Kasi syempre, we're 140, baka maraming nakasalamuha itong mga taong ito po.
Yes, ma'am. Actually, ngayon po, ang ating testing po ay yung mga nasa-send natin na specimens dito sa RITL ay dumadami na ng dumadami dahil nga po sa mga taong gusto magpa-test and going to the hospitals because they have symptoms. What we have done so far since last week, we have already revised our process whereby only those yung po may mga mild symptoms or are asymptomatic, we advise them to stay at home first, do self-quarantine, and then if symptoms would persist, that's the time that they get back to us so that hindi po rin sila masyado mahawa doon sa ospital and somehow we could rationalize the testing procedures.
Okay, pero hindi naman po delikado yun na you're saying if symptoms persist or kung mag-worsen na?
Hindi po. Ma'am, i-clarify natin. Let's clarify based on statistics and based on experiences from all over the world with this COVID-19, 80% of those with this kind of disease would present with mild cases. So these people who go to our hospitals usually are asymptomatic or has mild cases, and they would apparently say that they have history of travel or history of exposure. So what we do is assess them properly, and if doctors would assess them that they can go home, and then they would be managed at home doing self-quarantine. But for those patients, elderly patients, those with underlying conditions, those high-risk pregnant women, even with mild symptoms, we advise them for admission already.
Okay. Yusek, dito po sa total number of patients natin ng 140, ilan po dyan yung mga health personnel? Kasi we're also seeing reports na may mga health personnel na who were infected.
Yes, ma'am. As of now, wala ho dito sa data natin as to how many are health personnel. Doon po sa ating mga patients under investigation, doon po tayo nakakapagdala. As to those positive cases na health personnel, we still do not have that complete data for all of them.
Okay, but yun na lang din po, connected to that, kamusta po yung equipment for them, protective equipment for them? Kasi yun yung kumakalat sa social media that even government hospitals are actually soliciting donations for this.
Yes, ma'am. Actually, sa ngayon po, it's quite a challenge to be providing for all. Even private sector is asking from us about this personal protective equipment. As we speak right now, we still have our inventories, our stocks which we can provide to our hospitals. But of course, we are waiting for the donations coming from our partners and also our procurement for this PPE. So our objective is to rationally distribute these PPEs to all of our healthcare workers that they need to be protected, no, from this disease.
Ma'am, sa PGH po, kasi yun yung nakikita namin na may mga nagsusolicit po na for donations eh.
Ma'am, PGH is not part of the government hospitals, listed government hospitals. They are under the UP system. Pagka po naman ganito, we don't see anything wrong, no? If hospitals would start asking for assistance coming from our community. But here in the DOH po, we like to centralize donations so that we can rationally distribute among all of the hospitals that we have, and of course, help also our local government hospitals.
But even if they're under the UP system, that's still under government, ma'am?
Yes, ma'am. Opo.
Yeah.
And they're part of those who we help during this period for this disease. Actually, we had been coordinating with them also because of their expertise, and we are set to assist them if ever the need arises.
Okay, ma'am, yung mga, Yusek, yung mga gumaling po, ilan na po ba yung gumaling from dating positive?
The persons or the patients who had recovered from this disease are only two. They were the two Chinese nationals who are already back in their country. And then these 6 persons that we have placed under home quarantine, they are positive cases, but apparently, but they had asymptomatic, or they did not have symptoms, or they had mild symptoms. That's why it was advised and assessed that they should just do self-isolation at home, be managed at home, so that they will not, they will not be further infected when they stay in the hospitals.
So for now, ma'am, etong 6 na under home quarantine, you can't really say na, they're out of danger, no? Nag-home quarantine pa rin sila and under monitoring pa rin.
Yes, ma'am. Let us try to be very clear here. Those people who are on home quarantine, the 6 positive cases, they have not recovered yet. They are still being monitored strictly. They were just advised to go home so that they will not be in the hospital and, contract further complications of the disease.
Secretary, yung status po na lang ng testing kits po natin.
Testing kits, ma'am, meron po tayong existing stocks in our ITM. There are donations which are set to arrive. The testing kits that are being donated naman po from other countries, it's going to go through our FDA regulatory measures. These are all going to be facilitated. So when they submit their requirements to FDA, once FDA clears it, and then we can do field testing, and it's going to be used already. Now, about the locally produced testing kits, it has already, from UPNIH, it has already undergone and has been approved with its ethical clearance last Friday. And for today, it will start its field testing, and hopefully it will be used soon already.
Okay, thank you very much to Health Spokesperson Under Secretary Maria Rosario Vergere.